Once the fireworks end, a study shows the heart emergencies begin. Doctors at Mount Carmel are bracing for an influx of heart failure patients. This year, they can offer more help thanks to an improvement in the pacemaker. The explosion in the sky this weekend may be echoed in some people's hearts. At Mount Carmel East, cardiologists are gearing up for an influx of heart patients. A study in the Journal of Cardiac Failure finds some patients show up with heart failure the 4 days after holidays, including the 4th of July. Dr. Joshua Silverstein says patients break routines.
People don't eat well over the holidays and tend to have a lot more salt intake. I think another thing that probably contributes is people maybe skip some medications that they usually would be taking.
And regardless of when heart failure strikes, doctors here are encouraged by an improvement in the pacemaker. It's helped people like Mary Siebert of Pataskala.
I was rather in denial that there was a problem because I felt good, so there couldn't be a problem.
When it got too tough for Mary to walk a block and she had trouble catching her breath, she saw the doctor who diagnosed her heart failure.
I'd come home from work at 5 o'clock p.m. Is it too early to go to bed? I was ready.
There's actually 4 electrodes here.
Dr. Silverstein gave her something new, a defibrillator pacemaker that can be programmed to fix the rhythm on both sides of a patient's heart at the same time.
They're in heart failure because their heart is wobbling, so one side's beating before the other. We put a wire in the bottom right side of the heart and a wire in the bottom left side of the heart, and then instead of wobbling, we can make them beat together again.
Mary feels like herself again, well enough to take long walks with John and plan a mountain hiking vacation.
I feel wonderful.
The doctor says about 2/3 of patients are no longer short of breath after receiving this medical device, while the rest say they have more energy.